First aid during flight. A cabin crew member needs to be trained to protect passenger safety and help victims in an emergency. It is mandatory for flight attendants to undergo first aid training and bring medical kits on boards so they can offer assistance in case of an accident. Traveling by air can present a number of obstacles that call for quick emergency response and life-saving abilities. When there are no medical specialists present, the prompt action of the cabin crew can save a life. CPR training for cabin crew. A major difference could be made during medical emergencies on board by providing the cabin crew with complete life-saving skills and CPR training. There are several reasons for airlines giving crew members CPR training a priority. One, unexpected medical crises in the air might range from choking and cardiac arrest to severe allergic reactions. A cabin crew staff member must be trained in CPR to save someone's life in these unpleasant circumstances. Early CPR can significantly improve survival rates and reduce the chance of long-term problems. A proactive member of the crew can stabilize the passenger's condition and increase the likelihood of a successful outcome. Two members of the cabin crew who have received CPR training are not only qualified to administer CPR and other first aid procedures, but they are also taught to comprehend the physiological consequences of flying on the human body. They are able to identify possible risk factors and properly handle medical crises that may result from these impacts by receiving CPR training. On the other hand, cabin crews show their concern for passengers' safety by providing CPR and first aid training, which helps to create a positive impression of the airline's standards for travel safety. 3. Cabin crew must receive CPR training according to regulations, government entities, and aviation safety authorities. In order to maintain aviation safety, airlines should follow the rules and guidelines. 4. Cabin crew members receive training in CPR as well as other first aid skills like managing bleeding, controlling respiratory distress, and taking vital signs. All things taken into account, having CPR training will enable them to handle a variety of situations, including cardiac arrests and strokes. 5. It is more difficult to administer CPR efficiently in an emergency because the cabin crew must navigate through restricted areas and small passageways. There are passengers who behave differently in emergency situations, which increases the workload for the cabin staff. The remaining crew members must maintain control of the situation aboard the airplane and guarantee everyone's cooperation while some do CPR on a victim of a medical emergency.